Welcome back to another edition of the DAMY Vlog. My name is Dr. David Duizer. Thank you so much for tuning in. Today on the show we're talking about resources in integrative medicine and specifically access to literature, access to evidence supporting therapies. Today I was fortunate enough to find an excellent app called Journal Club. Journal Club is an app on, I think it's on iTunes, but I'm not sure if it's on Android. I'm sure that it is, that highlights some of the best trials done in internal medicine over the last 30 years or so, maybe even longer. I'm not sure. But the app is incredible because it reviews the trials that are done and gives a bottom line. Is what was found from this trial and how can you implement it into your practice. These are the kind of things we're looking for in integrative medicine, and I wish it was done. And I don't want to be I don't want to have to be the one to do it, but I might have to be. I've been flirting with the idea of starting a podcast that's specifically about integrative medicine research that has been done. A good place that actually has compiled a ton of research in complementary and alternative medicine is examine.com. I really like these guys. I think they're out of Toronto, and they've got a series of scientists compiling research and posting it on their site and giving it and grading the evidence for you so that you can say, okay, what level of evidence are we dealing with for each specific intervention that was studied. And examine.com does a pretty good job of that, but I think it needs to be organized better. I think it needs to be organized in a way that is easy to digest for integrative practitioners, and I'm considering doing it myself. Anyways, this Journal Club app is excellent because what they do is they look at the most famous trials done and they organize them specifically so you have quick access to them, and you can highlight for patients exactly why things are done the way they're done. And I find it beneficial because I have a ton of patients in my practice who really want to turn down conventional therapy, and in some cases they make great points, and we support them when they're right. And when I think that they may be wrong, I like to bring up the study showing why doing the conventional therapy is probably going to present more benefit than harm, and then have them decide, is this risk reduction important to you? What percentage risk reduction for whatever you're trying to treat would be appropriate? And then usually they have ideas, and I completely support that process specifically. Fortunately, I have a ton of time to talk a person through this, and it looks like this app Journal Club will allow me to pull up the resources a lot quicker than what I was doing, which was just going to PubMed or my own Google Drive and trying to find the study that I'm referencing. Now I can go into this app, and it seems like they're all organized in a way that's really fast. So I'm really looking forward to that. So thank you to Peter Attia and the Drive podcast for bringing me onto that. He was doing a podcast recently, I believe it's the next one to come up in my feed, with a preventative cardiologist, and they were speaking about some of the large trials that were done and how in cardiovascular intervention when there's coronary artery disease, they're saying that most of them are focused on preventing all-cause mortality, so trying to prevent death, which makes sense. But the problem is, in some of these situations, it could still be extremely beneficial to be focusing on quality of life. They were talking about placing stents or not, and if someone has stable coronary artery disease, it didn't make a difference whether they got a stent or not in the COURAGE trial for how long they lived. But when you have significant coronary artery disease, you can get short of breath really quickly, and you can't participate in the activities of daily living in the same way that you might have before you had the disease, and therefore it might significantly affect your quality of life, like say for example not being able to walk and exercise in general, and maybe having a stent in that case would be beneficial. But the study said that it didn't prevent death, so there's kind of that was their only conclusion. Anyways, when you have this app, you can quickly cut through that study if someone references it in the office, or if you have it in the back of your mind, like, okay, why are we doing this? Why should we go this route or that route? Then this app seems to be beneficial. In integrative medicine, like I said, I spent a lot of time on examine.com. I spent a lot of time on PubMed, combing through the trials and then trying to organize it in my own notes. And I think a good way to present this to people would be through a podcast, because we're doing a lot of our learning now on the go, whether it be driving to work or walking to work, or exercising. We need to if we're going to be moving ahead and getting better at what we do in integrative and complementary medicine, we have to be up on what has been done. We have to be up on what research has been completed. And podcasting seems to be a good way to connect with that research. However, when I comb through the podcasts that are available now, and I listen to a ton of them, I really like many of them in this space, and I like where people go with some of the data. But what I find is that people talk about their own story too much, or they in the way that they communicate or ask questions during the interview really presents a waste of time for what I'm interested in gaining, which is just the knowledge of what has been studied and how I can apply that in the practice, like one sentence, two sentences. How is this applicable to me as an integrative naturopathic doc? How can I apply this like today? I have patients in mind in all categories. I've got coronary arteries patients, I've got diabetes patients, I've got patients with all different types of cancer, and I want to know how I can apply something, and I want to know quickly. I was recently doing an interview with a consultant from a research firm, and they were asking me how I stay on top of what has been studied in integrative medicine. I said, well, I do my best, and I listen to these guys talk about what they've studied. I listen to them all go on podcasts and talk about their books, and I comb through PubMed whenever I get a chance. I do individual deep dives for patients, but the organization can be an issue. I know a lot of people use Evernote, a lot of people use Google Drive, some people use an app on Mac that's called Research, I believe. But it's tricky to organize your trials. It's very tricky to organize the stuff that you've learned. So we all try to do a good job of that. But my point for that person was that really what I'm doing is I'm trying to listen to the content when I have a chance, whether it be exercising or walking. And when you're exercising and walking, you don't have the chance to document what you have learned. So if it's a bite-sized piece of information, then I think that reviewing it later and organizing it for your notes might be easier. So I'm going to be thinking about doing that in podcast formation, because I've got a lot of things organized on my drive, and I'd like to share it. So I'll plan that in the future. When it comes to meeting with an integrative doc and a complementary or alternative doc, what you want to be thinking about is not really how effective the therapies they're recommending are, but what their experiences are with the therapies, how the therapy applies to symptom control, but also the holistic approach in treating the cause. So, we don't get too caught up in our practice with replacing drugs with supplements. We really can't get caught up in that, because it just becomes allopathic naturopathic medicine, which is simply replacing a statin with red rice yeast, or trying to find something that's replacing the medication, berberine for metformin, for example. But that's not going to cut it long term, and that's not what we're about. We're about the holistic approach. We're about treating the cause. So when someone presents a treatment plan to you as a patient, what you want to know is, why am I doing the things I'm doing? Where does each remedy fit in? You might leave an office with 4 or 5 things and 2 or 3 lifestyle interventions, and you're going to have to ask, what's the % chance of this working for what you're trying to do with it? Like, for example, if you come in with high blood pressure and poor blood sugar control, and you get prescribed some supplements to reduce your blood pressure and properly manage your blood sugar, and then the person recommends fasting or intermittent fasting or low carb diet, you went, okay, where does this fit in? What's the idea here? Well, the idea is that we want to reduce your weight so that your metabolic control, or your metabolic state is improved, and in doing so, the blood pressure will come down. These are the type of questions that can be really helpful. And then you might get something like berberine for blood sugar control, and you can say, why am I doing this? Well, it might be just as good as metformin, the drug for blood sugar control, and while we treat the cause, which is you're being overweight and having lack of muscle tissue, we can properly manage your blood sugar with berberine, for example, and your risk of pathology or risk of complications of diabetes will be reduced, because your blood sugar control will be improved. These are really great questions for your integrative doc. So think about that, and then they probably have their own pathway for organizing their data. Mine is is, like I mentioned, I'm trying to create files in my account so that I have rapid access, but now I have this other resource, Journal Club. I'm really excited about it. That's all I wanted to share for today. It's kind of some good questions for your integrative doc. How to approach a visit. I have some people come in and sit down and say, what's the % chance this is going to work for me? And that really isn't the best question. The best question is, what's the % chance it's going to work for this thing that we're trying to apply it to? And is it the cause? Is it the holistic approach? Or is it the symptom management? And that can be the best way to approach evaluating your treatment plan and using it long term. Hope you enjoyed today's video. If you like videos like this, please like and subscribe. We'll talk tomorrow. Bye.